Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Viktoriia. How are you doing?
Hi, it's fine. How are you?
I'm doing very well. Since this is the first time on the podcast, would you mind doing just a quick introduction of yourself?
Yeah, no problem. Hi, everyone. My name is Viktoriia. I am Chief Medical Officer in 3rd Army Corps in Land Forces of Ukraine. In my normal previous life, I was a physician, obstetrics and gynecologist, but in 2014, 2015, I have had so short experience for being combat medic in National Guard in the east part of Ukraine. And since 2022, since the first day of the full-scale invasion, I joined Army second time. I had some period when I worked on the Medevac as a doctor, as a physician on it. And since the 3rd Assault Brigade was created, I started to work with some administrative things like a chief medical officer in the brigade, and now I am my zone of responsibility. It's more than 150 kilometers of the front line and all medicine which we have now on these locations, from the battlefield to the role 2, with trainings, planning, support, logistics, etc., etc.
Thank you very much for jumping on. What I would like to talk to you about is, at least for me, the Ukraine-Russian war, the takeaway is just adaptability and how adaptable armies, people have to be in order to save as many lives as possible. And I think Ukraine and their abilities to adapt to an ever-changing battlefield, and really, I think, pushing that adaptation has been incredible thus far. So I think if we could, I'd like to talk about the trainings of the medics and how have we passed on these lessons so that future generations of medics can be just that much faster, right? So I think it's always important to just start from the beginning, pre-war with Russia. What was the medical training like for the military?
When you talk about the pre-war period, we are talking about the before the 2014. To be honest, it's not about before 2022, because the war was started in 2014 with the invasion of the east borders of Ukraine, and in that period before that, the main trainings which we had in our schools and universities, it was the same programs as we had before in 1990, 1980. It was so close to the Soviet Union education system. And we had some things like how to provide medical care with tourniquets, SMARC, and these old things which we had in our first aid kits before the war. But it was absolutely non-modern things, and it was like the previous centuries and not about what we need here and now.
How long roughly were the courses?
I cannot tell you about the universities, like correct hours, but in schools it was during 1 year. It was the last year, and you have, for example, one lesson per week. It was like approximately 45 minutes, and every week you had some training or some lecture about how to be as a part of the army and what you should train for for being a good soldier, and what you should know from the military medicine, how to, or know how to use some specific medicines, how to use some specific SMARs, and how to use some specific bandages, which is from from your grandfather period.
Now, this was while you're in medical school, correct?
Then it was before medical school. In medical school, it was maybe approximately 6 months, 6 months period, and during that time you had maybe a few 2 hours per 2 weeks for these trainings. But it was also about previous centuries, not about these modern things.
And then 2014 happened. The U.S. and other NATO allies start doing cross-training. I guess how hard of a shift was that when you have Western countries now trying to adapt Ukrainian how they're training their militaries? Was that a difficult transition, or did they just accept it and follow along?
To be honest, for people who understood that they should not only fight but and survive also, they understood that they should know everything from these first aid kits, how to use it, what is it, and they was interested in all trainings because I was a participant of this training in summer 2014 before my joining the National Guard, and I didn't remember any person who didn't want to train, or for them it wasn't easy, to be honest, because it was absolutely new things which you didn't see before, and you had to understand how to use it, and to not only how to use it but how to save it, because you didn't have any additional things, only one first aid kit. And for that period it was really difficult, but first motivation and understanding why we should be trained with this equipment, it was 100% of that. And a great things which we had in that period, it were motivated instructors who visited Ukraine and who trained people not only how it looks like but also how to use it. It's the main things, how you can use it, how you can keep it, where you can fix it, etc., etc. And that's why it was very good things.
You're starting to do the cross training now. Obviously, you're starting to get into interventions, especially as we get into 2022, 2024 timeframes. Interventions, such as blood, things that, like, the U.S. wasn't doing it, but during GWAT up till 2020, really. As far as medics on the battlefield doing blood transfusions, but I'm sure they're doing other things that physicians wouldn't normally allow medics to do. Maybe needle decompressions or finger thoracotomies, chest tubes, etc. How was the adaptation of these new, T-C level skills to medics and opening up their scope of practice? I know just in the U.S., it's always very hit and miss on what providers are okay with and what providers are not okay with that.
As you know, any not only challenges but also any changes in bureaucratic structure like army, it's every time is difficult, and sometimes it can be more difficult by the paper and less difficult in the communication between people, because to explain what you want and what can you do. It's easier than sometimes to write it on the paper and to approve it. Since 2022, these trainings, we had these trainings before. We had it on the basic general military training. It was before you joined the army, and we had this type of trainings for people who were inside the army, from the NGO and for training centers which we had in Ukraine, in different corners of Ukraine. And in the first year, during the first years of the big war, we didn't have some problems with some approving from the NGO, because the main thing it was to train the person, and last problem we had was some bureaucratic things. We didn't think so more about that. We more think about how to train, how to find good equipment for the soldier, and how to find the new equipment if it was lost during our activities, or some heating or something like that. Yeah, and now we have in the 2026 we have a lot of NGOs who provide these trainings. We have the official training centers from the armed forces, and also we have the instructors who work on in training centers for this basic general military training. And in this basic general military training, they provide training during 30 hours of this general training, only for the military medicine, tactical medicine. After that, the person who joined army, he after the finishing this general training, they were transport to different brigades, battalions, regiments. It depends on which is the final destination. And in this brigade, they have the adaptive period during 14 days, 30 days. It depends on the brigade and Army Corps, how they decide how many time they need, but not less than 14 days. And during that time, they trained their soldiers for the higher level of mine security, air security, for example, general military, some trainings. And also, we have in this type of adaptive period trainings for the military medicine. In our Corps, it's training to the CLS level, and we try to train all our infantry to the Combat Lifesaver level, for the possibility to provide medical care, provide medical care for themselves and for their brother in arms on the battlefield, in the case when combat medic is not so close to them, or some obstacles are not comfortable to get this combat medic, or you should stay for long period on some position and wait evacuation, and you have to know how to do it. And that's why we try to make it during adaptive period. Next time, when you will have the training for the tactical medicine, if you're infantries, it will be the period of rotation from your position. You stay some time on your position, and after that, you have some rotation in the nearest frontline location, and you will have the trainings of general military things, mine, assault missions, etc., etc. And also we have trainings with combat medicine. It's not about some hours. It's about including in general training different things which we can include in this position. It's like imaginable situation with casualties during your mission and something like that. And that's why we try to make some, refresh for people how to use their knowledges, their competences in different cases. And this repeating can be, so many times as you have this rotation, because we will use this tactical medicine every time. For combat medics and for combat lifesavers, this process little bit not the same, because they have their professional refreshers from our internal instructors. In our Army Corps, we have our instructors who train combat medics and combat lifesavers every time, like every year for the refreshing, or sometimes if we have some changes in the program, some additional things, we will start to train them as it can be possible after the rotation from the battlefield. Yeah.
So the 14 days and the 30 days, is that for the soldier or the medic? Their initial training?
For also in general training, 30 hours.
Oh, 30 hours?
Yeah. In general training, it's about 30 hours of tactical medicine. In adaptive period, during 14 or 30 days, we have 2 until 12 days of military medicine. It depends of how long this period, adaptive period, we have in the brigade. If it's the most short, it's about 2 days. But 2 days, it's better than, for example, 0, 1. Yeah. And these people come to a brigade with some level of tactical medicine after general training. It's not like the 0 line. We started to train them like next step. And it's easier to explain something because people have some previous background of training, and they know what is tourniquet, how it looks like, and like that. Yeah.
And so I'm guessing like the general training, that's like what the Americans at least would call like your basic training. So everybody goes through this phase and they get roughly 30 hours of medical training.
Yeah.
And then we would have your advanced training where it's more specific to, you're going to be an infantryman or you're going to be an artilleryman or a cook, whatever it is. But the medics would get an additional 14 to 30 days. Is that correct?
Yeah, I'll try to clarify a little bit more. General infantry, all soldiers who join to the army have the period of basic general military training during 55 days. I hope that I didn't spell the mistake.
No, just the medical portion
And
is 30 hours.
Hours, it's medical period for all of them. If they will be, I don't know, if they will be included in the group of combat medics, they will have 1 month more training only for combat medics. But if they will stay the infantry, they join the brigade and then have this adaptive period for everyone. And other type of specialties, artillerists, some miners or other ones, they have their period of general training and then additional specific course about artillerists or artillery or mine security or something like that.
Okay, so the medics get an additional month to become combat medics, right?
Yeah.
So this is when the war started, how things were set up.
I'm sorry?
In 2022, this was how things were set up to begin with.
Yeah.
Okay. Unfortunately, people die in war, numbers get attrited, we have to replace them. Has that general timeline, has that had to adapt to needing more people on the front, or has it stayed the same?
When we talk about combat medics, now we talk about combat medics, yeah, we have the lack of the combat medics in our brigades, And that's why we try to train everyone to the CLS level. It's one of the I don't know the answer for this question, how to replace this problem. Firstly, it's about training everyone to the CLS level. Secondary, it's trying to use the combat medics not with assault groups, but closer to our position, because to train combat medics is longer than to train some infantries. And combat medics, unfortunately, for our enemy, it's a target. The interesting target is the same case with Medevacs, which when they try to, not only try, when they hit that, it's a situation when any convention law doesn't work. And that's why we try to use combat medics closer to our position, to train people to the CLS level, and to use and to train to have the instructors not only in training centers but in the Army Corps, because of the possibility to train more people inside like small system, like in every structure of this big system. Because training center, the number of training centers are not enough to train all people in the army, and it's easier to have your personal instructors in your structure who will be every time not free, but have the schedule of training your people and refresh knowledge for your people.
Okay, so that makes sense. The idea is not necessarily shrink the school, but to elevate everybody else around them so that you're just going to be more adaptable. People are going to be more capable of handling situations for a longer period of time because they have just more training overall, everybody around them.
Yeah.
So it's not, everything doesn't fall on the medic themselves.
Yeah.
Right?
Yeah. Yeah.
Now, that alone is a feat. You also have things change. Technologies change. Drone warfare has become enormous, where maybe early in the war it was artillery barrages and missile strikes, which of course continue, but now we have drone attacks. Things have got to change, and we have somebody who is, a combat lifesaver medic who has been trained by the West, or in Ukrainian military, has adopted things from the West. So these things are not, they don't jive necessarily together. They don't mesh well together. The Ukrainian military, you have to adapt. And now you're going into, now we have to find out what does work. So if the courses they're not going to get longer, right? Because we still need people to fight. How, and I guess where are we teaching these adaptions, if that makes sense? Like, when do they learn how to, survive being around drones or survive these artillery barrages, things like that? Where are they getting the experience? Is it from the internal trainers and in their units that's giving them this more lessons learned type thing?
We tried to most instructors which we have in our on our general military trainings, basic general military trainings, there are instructors who have experience from the battlefield during previous years. That's why when we try to train, they have this component of personal experience, not for using in the training, but for these explanations that it will be not so easy. If you want that battlefield, it's like an interesting picture. It's so hard picture. Secondary, unfortunately, all Ukraine are the target. All territory of Ukraine is a target for the Russians, and every day, sometimes a few times a day, we can see drones on our territory, Shaheds and some other types. And for people understanding that something in the sky can kill them, it's not something new. It's our everyday's reality. And that's why, to explain that from the sky you will have some dangerous, you don't need to explain that. But when you come to the nearest frontline zone, the number of drones, different type of drones, also glide bombs and other ones increase. And in that case, people tried firstly to be trained in the nearest the frontline zone for understanding how to be more prepared in their mental space, in their understanding what you can do if you know if you hear the information about drones, what type of drones, how many time you have to run from this location to some not shelter, but something like shelter, let it be, and what you can do during the time. And it's so important thing because it's like a training for making decision what you will do in that case, what will be more priority in that case, to continue this providing medical care, or only stop with fixing some tourniquets, and then to move to some shelter, and then wait for the hitting drones and other place, and only after that to continue, or to try to continue in this shelter. It's everything about decisions, and rapidly decision, because you don't have a lot of time to think. Sometimes you can you have to decide here and now. And this one of the main competences which you need to have in this work.
Yeah, I mean, the decision-making process is so incredibly important, because the skill of putting a tourniquet, or the skill of putting a bandage, or the skill of opening an airway, it's not particularly difficult. It's knowing when to do it. It's, when to evacuate, like all these little decisions. That's, I think, is incredibly important, because that's how somebody locks in all these skills, whether it's dealing with the environment, or dealing with the tactical situation, or the medical situation. That's how they're able to do it, is if they get knowledge and experience and training in how you make the decision. Yeah. So, with all these threats, like you mentioned earlier, it's a very transparent battlefield. There is constant surveillance. There is constant threat somewhere nearby. So, it's the time it takes to get from the point of injury back to a roll 2 or a roll 3, we would call it. Like, it can be hours, it can be days, it could be weeks. How are the combat medics? How are the CLS, the Combat Lifesavers? What kind of things are you now training them so that they can actually sustain a casualty for days, weeks, essentially on what we would call the X, or the point of injury?
We try to train these people how to provide wound care, and what you can do with wounds. Also, so important thing during this period, this drone period. I know that in general important hypothermia, but during the drone period and delayed evacuation, it's in this importance increased, because of staying a lot of time in the trenches, in some shelters in cold buildings during waiting for the evacuation. And this hypothermia management is important thing. Second one. Thirdly, we can talk about prolonged field care in general, but as I call it, it's a prolonged field care under fire, because you cannot do everything what we can read in this training and what you can hear in this training, because of the fullest transparent battlefield. And this, when the sky is completely saturated with reconnaissance, electronic warfare, and strike drones, you cannot make some small interventions in the abdomen on other place. You should do the most important things, which you can do with the higher level, the highest level of security for the patient and for you also. And next one, it's blood transfusion training. First one, how to use the blood on different stages before the hospital, on the pre-hospital level. Then, and actually, other type of trainings. So it's not so about medicine, but more about their possibility to survive. It's air security, mine security, different types of weapons which can use our enemy, and also a small part about CBRN. Using the CBRN because of this possibility in Russians, and it's not like about some big explanation. We understand that they can use it, and during that, yeah, and they have it, yeah, and now. Firstly, as I told about hypothermia, it's really being heavily prioritized in training. Because of wounded soldiers must wait, as I told, hours, sometimes weeks, days, I don't know, for the evacuation in freezing damp trenches. And this training now emphasizes aggressive hypothermia management earlier in the cycle, because we need to think about that as early as it's possible. Furthermore, due to the difficulty of finding a vein in the severely dehydrated or bleeding patient, training regular infantrymen in intraosseous access drilling directly into the bone to deliver fluids, warm fluids actually, has become a standard frontline skill also. It's it's we can call it like evolution of TCCC standards, because sometimes we replaced these letters in this in March protocol. To be honest, in blood for forward, in this case it was also this history. It was also during full-scale invasion. It was one of the most revolutionary updates in the policy and training surrounding the pre-hospital blood transfusions, because in Ukraine we didn't have it before 2022, and we got it, is I correct remember, in 2023, in summer 2023. Historically, only certified doctors could transfuse blood in Ukraine, meaning soldiers in hemorrhagic shock often bled out before reaching a surgical unit. That's why we need to use the doctors as close to the front line as it's possible. But following intense advocacy from the frontline medics and organizations, also foreign organizations, the Ukrainian government changed this law. And now combat medics without formal medical degrees undergo a specialized 32-hour transfusion therapy course developed with the Ministry of Health. And now we have in the center of the regional center of blood We have the providers of this course, official providers, and we can get this knowledge. Our combat medics can get this knowledge in these centers. These centers trained to administer low-titer group O whole blood and dry plasma directly at the point of injury. But now it's so difficult to deliver this blood to the point of injury because of actually drones and other dangers from the sky. But these changes in the trainings were so important for us because we started to use blood earlier than it was before. Yeah.
Perfect. So just now your position in how much of the front and how many medics and how many combat lifesavers, your position affects.
A lot of.
Do you have? Yeah,
I
lots.
tell
There's
you the
lots of
number.
people.
Yeah.
Lots of people.
Yeah.
Being able to adapt. Now that you're kind of in charge of the structure that helps that adaptation and drives that adaptation. Could you give advice to other, commanders or other people who are in charge of personnel? I guess how any advice about how to adapt the system to further facilitate, just education and training for the medics? Like how can you use your position to adapt things for the medics for their benefit so that they can save more people?
Firstly, the most easiest it's to try to learn from Ukrainian experience. I think because when you try to learn from somebody, it's not about your bloodless. It's about bloodless of other country, and that's why for all commanders, the most important is to save their people. And when you can see how it looks like in Ukraine, you can make some decisions for your trainings, firstly. Because I like to talk not about lessons learned, but lessons identified. Because about lesson learning, we can fix it only in the future if you use this information and this experience. And lessons identified, we have a lot of these lessons now. And that's why in Ukraine we have a lot of these lessons and use the experience from Ukraine. Secondly, I absolutely understand every country with their law. That's why this experience should be adapted for the law of that country in which we want to use this knowledge. And third, it's maybe not about medicine and not about adapting, but about understanding what and when that can be improved. Don't lose the time, because in Ukraine we don't have time. We don't have this time for the preparation. But when you have this time for the preparation, you should use it not for watching, but in general for the preparation. You can train people with some standards during this year, and if something will change, you can start to train people with this changing. This war is so rapid, and this war is changeable actually, because we can see that during Russian-Ukrainian war, that from the artillery through the aviation, then glide bombs and mix with drones, it's absolutely different type of weapons and absolutely different type of wounds and possibilities to realize medical care on the battlefield. And that's why all the changes should be included in these trainings, because we have this, I love the sentence that generals prepare for the previous war. Let's prepare to this war. because you have this war not in parallel reality, but in parallel country. And use Ukrainian experience. It's the cheapest way to train your people without any losses.
Awesome. Very good. Hey, thank you very much, Viktoriia. I really appreciate you coming on.
Thank you.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast. Out.